Well, I've been having some discussions with Professor David Anderson recently, and we're both very concerned about these experiments that are going on to reduce the amount of sunlight that's coming to the Earth, that scientists, it seems to us, are fiddling around with things that don't understand, and the risk is on us, of course. We're the ones that are going to get less sunlight. Professor, thank you for coming back on to discuss this really quite important matter. How do you feel about these experiments, Professor?
Well, I think they're outrageous because we, especially in the northern hemisphere, far from the equator, sunlight, which is absolutely crucial for the formation of vitamin D, which is absolutely crucial for a whole number, control of 1,000 or more genes, including genes for natural immunity. To interfere with the sunlight over Britain or in the northern hemisphere is absolute insanity. It's deliberate. It's not insanity because there's madness in their method, or method in their madness. But vitamin D deficiency, it's becoming increasingly apparent that this is a major problem to humanity now. And I think there are many lessons to be learned from the history and the evolutionary history of mankind, and particularly the last time we were threatened with severe vitamin D deficiency.
I want to go on to that, but this point about it not being madness. Now, it is, to me, these experiments are madness, but the people that are conducting these experiments are not mad. They're intelligent.
Not normal.
They're intelligent people, so why would they want to take our sunlight away and reduce our vitamin D production and reduce photosynthesis? I mean, I know you can't answer that question, but you know, it's easy to say this is complete madness, and it is, but you know, without being conspiratorial about it, one wonders if there's other things going on behind the scenes which we can't possibly be privy to. It's all very, very, it's so bizarre why they would want to do this to me. Well, what's your thoughts on that?
Well, I think there is a conspiracy against vitamin D, a global conspiracy in which, for example, big pharma and big money are involved. The reason for that, and it is outlined in David Grimes and my two books on vitamin D deficiency, first on COVID, and second on the vaccination. Yeah, and we in fact in that working on that second book, I really came out of retirement and started to read much more about what was known about vitamin D and immunity, and it's the role of deficiency in human disease. And I think that right back more than 100 years. 100 years ago, Glaxo, I believe, were marketing vitamin D. They stopped doing it. And people were taking massive doses of vitamin D. And this was a big threat to the healthcare industry because everyone was much, much healthier. So at that time, the unitage of vitamin D was redefined, to tiny amounts of vitamin D. And the powers that be tell us now that 400 units of vitamin D is what you need. That is what you need to cope with the latest evolved function of vitamin D, which concerns calcium metabolism. And that is important, but it's the bull in the field. And if you reckon the dose of vitamin D based on what the bull takes in terms of thinking of water trough, and forget about all the less aggressive cows, you are going to head for immune deficiency, and they know that. And that is, this is discussed in our book. I found it very hard to find a disease in which vitamin D deficiency was not involved. So, and this is compounded further because every time you get vaccinated in any kind of vaccine, and these nucleic acid pseudo vaccines, of course, are incorporated into one's genome. There's a great risk of that, and it's creating a death all round. Acute myocardial infarctions, all sorts of chronic diseases, autoimmune diseases, and now cancers. Especially, and these are this. Yes, it is a conspiracy. They know about it. They know about it. Bill Gates knows about it because I sent him a copy of my book.
Well, if Mr. Gates wants to talk about your book, David and I are welcome. Yeah. Did you get an acknowledgement? Did he say thank you, Professor, for your book, or?
No, but I think I checked that it had been received.
Well done, excellent. So we know he's got a copy of your book. I mean, is vitamin D important for preventing cancer as well?
I'm sure it is, absolutely, and especially in the context of these pseudo vaccines. They actually deliberately, through the interaction with the furin side, they interfere with vitamin D's role in eliminating very early cancer cells. So all cancers, but some in particular. And we're seeing now an epidemic of cancers in young people. You know, we've lost relatives in their 50s from bowel cancer. And you see people dying left, right, and centre of diseases. So there's certainly been a very big crime to give these pseudo vaccines to people who are at absolutely no risk from COVID itself. So, you know, to give it to children, this is